At Spotscreen, we don't care if you have smelly feet, fungus growing between your toes. We don't care if you have spots or holes in your undies. And we don't care if you've got cellulite or wrinkles. We've all got those. What we do care about is your skin and your health and whether there are any spots that are really suspicious. So, we care about you. It's often very daunting for a person to come and have these sorts of screenings done for the first time, so we really want to make sure that they're relaxed and engaged. Hi Rob.
Hello.
How are you? I'm Karen. The second thing I do is to take a short history of their skin to make sure that they don't have any underlying skin or skin health issues that may mask something like a skin cancer. I then go through a history of their UVR exposure, either at work or at home. And I'm particularly interested to see whether they undertake any sun safety protection.
Working in mineral sand just sticks to you.
I completely understand. What we'll be able to do is provide you with some information on different types of sunscreen, because that's a huge concern, particularly with men in the workforce. When they're comfortable, I will ask them to disrobe. During the process of examining their skin, I use a couple of instruments, and the first being a dermalite, which is able to magnify the skin and light it so that I'm able to have a really close look at the surface of the skin. Just looking at your skin, all the freckles, if you're looking over your own skin and you're seeing freckles, they should all be fairly well uniform with their colour. So you can look for what's called an ugly duckling, something that's a little bit different from the rest, and that might be because it's darker. A fact that people aren't aware of is that sometimes we do find melanoma on skin that hasn't been exposed to UVR, and unfortunately about 5% to 10% of melanomas will occur on a body part that hasn't had any exposure. And that may be between the toes, for example, where people normally wouldn't suspect to find a melanoma. Bob Marley died from melanoma on his big toe, and because he was a Rastafarian, he wouldn't have any surgery to remove his toe, so it killed him. If we're seeing 100 people, we'll refer about 20 of those on, and often they're very suspicious lesions which we suspect may be non-pigmented type of skin cancer, such as basal cell carcinoma, for example. That's very common. Sun damage like solar keratosis, that's very, very common, and probably the number one referral that we give for. Melanomas, thankfully, are a lot rarer, but we do have occasions where we might find 2 or 3 in one day at one workplace, and that's really scary. Scary for the people, and it's scary for the workplace. Certainly we get them off to see a doctor as soon as we possibly can. And more often than not, I would say a larger majority of people have a really good outcome because of that. If I see something that's unusual, that I feel might look suspicious, I'm able to use what's called a cystoscope. And that's a camera that shoots a particular type of light below the surface of the skin. And that light gets picked up by different aspects of a particular lesion, and then we can have a look below the skin. And I'm able to see whether there's any damage or any underlying features that may be indicative that a mole is potentially either becoming a melanoma or is a melanoma. Absolutely nothing going on below the surface. It's a blank screen, and that's exactly how we want it. When I see something suspicious underneath the skin or on the surface of the skin, I'll refer that patient onto their own GP wherever possible. If it's very urgent and that person doesn't have their own GP, then I'm able to assist them to get an urgent appointment with someone who is familiar with skin cancer medicine. People ask me if I ever get bored looking at so many different skins and whether it's boring looking at the same thing. And my answer to them is always that I feel like I'm looking at a different landscape every time someone new walks through the door. I think I've got the best job in the world. I get to spend 15 minutes with naked people. 27 times a day. That has to be a great job.